Welcome to the Read, Talk, Grow podcast, where we explore health topics through books. Our topic today is stroke, having a stroke, but also focusing on recovery and rehabilitation after a stroke and being a caregiver for someone in this situation. Our book today is What Happened to the McCrays by Tracey Lange, published by Celadon Books. I'm your host, Dr. Denise Milstein. I'm an assistant professor of medicine at Mayo Clinic, where I practice women's health, internal medicine, and integrative medicine. My guests today are Tracey Lange, who graduated with a degree in psychology before owning and operating a behavioral health care company with her husband for 15 years. Her first novel was the immediately best-selling We Are the Brennans, followed by another bestseller, The Connollys of County Down. Her third novel is What Happened to the McCrays, and she joins us from Bend, Oregon, where she lives with her husband, sons, and beloved German Shepherd. Tracey, welcome to the show.
Hi, thank you so much for having me.
I have to say, this book was not a hard sell for me, Tracey. I loved both of your first two books, and I'm a hockey mom. So when
Ah,
I saw Health Condition, Hockey, and Tracey Lange, I was in without a doubt.
oh, great. Thank you.
Our expert guest today is Dr. Courtney Hrdlicka. She's a neurologist with a subspecialty in stroke and cerebrovascular disorders at Mayo Clinic in Arizona. Courtney, welcome to the show.
Thank you so much for having me.
What Happened to the McCrays is a modern novel about a fairly typical family navigating a health crisis and its aftermath in the midst of interpersonal strain. Its main character, Kyle, has returned to the small town where he grew up and lived before his marriage fell apart. Now he's being called back to help care for his father, Danny, who's had a stroke. Okay, you both know how Read Talk Grow works. We discuss books that portray health topics in an effort to better understand health experiences through story. In this case, we're going to discuss the recovery and caregiving after a stroke. Tracey, tell us your inspiration for the novel and particularly the character of Danny.
As far as the novel goes, I sort of figured I'd be diving into divorce at some point. My parents divorced when I was in middle school, and it was not what you would call amicable. And I was sort of lots of drama and very hard on all of us. I kind of knew at some point I'd be diving into that topic and exploring it. So that was sort of the inspiration for this book, which is really just kind of a close-up look at a failed marriage from both sides. And as far as the character of Danny, he was part of the story from the beginning as Kyle's dad. And I knew they sort of had, as I was kind of getting to know their dynamic, I knew they kind of had a strained relationship. But when I thought about bring Kyle back to his hometown, I loved the idea of using that as an opportunity to explore his relationship with his dad because it has been sort of strained over the years, kind of fraught. And then when I just kind of went deeper about what would bring him home, what's going on with dad, the idea of this sort of big, strong guy, who's very independent, doesn't like to rely on anyone, is suddenly, that's Danny, is suddenly in a position where he needs help, even though he really doesn't want it, particularly from his son in some ways. So that's kind of where that started. And then I just, from there, all kinds of questions presented themselves about, okay, what happened to Danny and how can Kyle help and like be part of his recovery and so, I researched various ideas, and that's when I landed on the idea that maybe he had a stroke, and that's what brings Kyle back.
And I've heard you say in interviews previously that the way you write is really to kind of sink into relationship with your characters. And once again, in What Happened to the McCrays, that just absolutely comes through. In fact, with all of them. So again, well done.
Thank
It's a
you.
fantastic book. Courtney, tell us your reaction to the book.
I really enjoyed it, and it was really interesting for me to see this depiction from kind of this interpersonal and family relationship dynamic aspect of how strokes affect people. And I think it was a very realistic description of the way that this very sudden event that's so out of someone's control can make a massive difference, not only in that person's life, but in the life of their immediate family and extended family and the community around them. It really can have a very large impact on a lot of different aspects of someone's life and community. And I think you did a really excellent job in depicting that. One of my favorite parts of your depiction of Danny and his stroke was his improvement and how he slowly improves and recovers from these residual leftover symptoms that he has after the stroke.
That's so nice to hear, Courtney, because I'm not a doctor, of course. I did lots of research and lots of talking to people, but to hear you say that you felt like there was some accuracy there feels really, really good, because it is fiction, but it's certainly what, we're going for.
No, this certainly rings very true from my experience of, you know, hearing from patients and families as they recover of what this is like and how big of an impact it can have, even if you end up going on to recover and doing well in the long term.
Mhm.
For the short term and the medium term, it can have a really big impact for a lot of people.
And I wanted to just highlight what your role as a stroke neurologist is often caring for the person who's had a stroke, but there's no way you can do that without also working with families and caregivers and really teams of people who are going to help with the recovery process. But we're going to talk a bit more about that in a
Right.
moment. Tracy, we see Danny's stroke in stages. First, when he's laying on the ground, next, when he appears frail and resting in the hospital. And then Kyle, his son, is seeing him for the first time, finally awake, but not the man that he remembers from their last interaction. It's such an incredibly realistic way to even present those first stages of stroke. Can you tell us how you came to make that choice and researching what that looked like? Because you did do it so well.
Thank you again. Yeah, lots and lots of research. But I'll tell you one thing that's so interesting when I research something like this, the impact of a stroke on someone. There's another character in the book that's in a wheelchair. A previous book, I had a character with a traumatic brain injury, and all of that required lots of research. But what was so interesting to me, and I'm kind of sort of becoming used to it now, I guess, is you go into it thinking there are going to be this sort of almost a formula, like here's what happens in a stroke, here's the impact, here's the recovery. But what you realize, it is so incredibly different for everybody as far as the impact, how they recover. I almost hope to get guardrails, so to speak, from my research that would say, okay, this is how this is going to work. And then I realized that's not how it works. It's different for everybody, which gives you some flexibility, but it was just super interesting to see the vastly different impact on not only the stroke victim, but then their families and how all of that works. So, yeah, lots of research went into what happened to Danny. And I wanted to see a lot of that through his son's eyes. Here's this firefighter dad that's always been a little bit larger than life in Kyle's mind. And of course, to see him then suddenly so vulnerable and sort of weak physically. And so I'm glad that came through, because I watched before my dad died, I sort of watched that transition. And so I know how impactful that is to see.
Yeah, and just to expand on that from a medical perspective, Tracy's exactly right in that because your brain controls everything that you do, a stroke can affect any part of your ability to function. And the degree of severity can range from minimal, even symptoms right when they start, to absolutely devastating in each domain of that part of your body or that type of function of your brain. So you're spot on that there is no one typical or common way that stroke affects people.
Right.
Yeah.
Right. And I can only imagine it's just like this happened in the story. You just don't know. You don't know you're hopeful. You don't know what's going to happen. You don't know exactly what the prognosis is. And so there's just a lot of waiting and hoping. And it ran through my mind several times, being the medical professional in that situation where you have people that just want answers. Tell me what to do. Tell me what's going to happen. And you don't know.
Yeah, I've been on the other side of that conversation many, many
I
times, and
bet.
it's really difficult because I wish I could give people a clear answer. But every brain and every stroke is different. And
Right.
we're really bad at predicting with a great degree of certainty in a lot of situations. We can give you kind of broad outlines, but then as more time goes on, that kind of best case scenario and worst case scenario get closer and closer together over time, but that process is much slower than people and their families would like.
Sure. Yeah.
And so it's a lot of uncertainty after a big scary event.
In Danny's case, specifically, Courtney, he has these jerky movements, this halting speech, a left side droop in his mouth. Is this one common presentation for stroke?
Yeah, it certainly can be. Weakness of one side of the body is very common. The type of trouble finding words that Danny has is also very common. As a symptom of a stroke, our brain language and communication centers are pretty big and important, and it's becomes statistically relatively common to for those areas to take a hit as well. And so the type of symptoms that he has and the type of struggles that he has are very, very common. But like we're saying, there's no prototype, but I see this situation very, very frequently.
I really liked the idea of, he needs his son to help, and Kyle wants to help, but their communication is just like immediate conflict there. They already kind of had their attention, but then to be in this situation where he's trying to figure out what his dad needs and his dad can't communicate very well and he's frustrated, it just made for some really instant conflict there for them.
And that's so real world. Families have interpersonal conflict, and when a big medical event like a stroke happens, it brings these people together who have these underlying conflicts and sometimes put people who have these conflicts into this direct caregiving role, like Danny and Kyle. And that has real challenges. That's so real. We see it. This is happening to people every day.
Yeah, honestly, Danny's stroke is what I consider the sort of inciting incident for the entire story, because it is what brings Kyle home back into, his ex-wife lives across the street, so they're in each other's orbit, but and she's close to her father-in-law still. They have a nice relationship. So it really is sort of sets the whole story in motion.
Yeah, and I think you're right that this is a really common way for this to happen. In fact, Danny's stroke is fairly traumatic in how it's found out. So you've mentioned Casey, who's Kyle's ex-wife, who lives across the street but remains very close to Danny even when Kyle's not living in the town. And she finds Danny on the floor. She comes over for some reason, unrelated reason, and finds he's fallen to the floor, he's hit his head. He's bled all over the place and now has a concussion on top of his stroke. Tracy, I had to keep layering these things on this poor guy. But that is, again, pretty realistic. Not every stroke presents this way, but that the symptoms come on suddenly or can come on suddenly and affect whatever you're in the middle of doing. So if you're standing in your kitchen and you fall to the ground, if there's a sharp edge, you just might hit it. So can you talk about deciding that? Is it, again, a literary device to bring Casey and back into this orbit and all of that? But still, that was I think, brave decision to make.
Yeah, when I realized it would be Casey who would probably find him, she still pops over. She does things like clean out his fridge still. And so when I realized that she would likely be the person to find him, I did make it even a little harder on poor Danny with when he hit his head on the way down. Even that, just seeing him that way kicks up an awful lot of turmoil for Casey. And of course, the fear. And at first, she's not sure if he's still alive. And so it takes a huge toll on her. And then, and then Kyle comes back and sees him the way he sees him. So that's kind of why I added a little head injury in there, was just to really, because that does bring back some memories for Casey as well. So yeah, in so many ways, his stroke is really what sets all of this in motion.
Listeners will have to read the book to find out what you're talking about, Tracy, because we are not going to spoil the book today.
Okay.
Courtney, I think a lot of people think that stroke presents this way with this kind of sudden collapse or suddenly can't
Mhm.
move one side of your body. But can you tell our listeners how mild strokes could even present? And maybe this is a good time to talk about how important it is to get care for stroke as quickly as possible.
Well, thanks for giving me the opportunity to say something that's going to help me sleep better tonight. So this is exactly strokes generally happen very suddenly. Not necessarily 100% of the time, but generally it's a very sudden onset of symptoms, and so the vast majority of the time people don't have any warning. And it can be big and dramatic, fall to the ground. Everyone who sees you knows instantly that there's something very wrong. But it certainly can be a lot more mild, where you could be in the middle of having a conversation with someone and they don't realize it, but all of a sudden a curtain came down over one eye and now you can't see out of one of your eyes anymore. Or you could just suddenly have a little bit of trouble finding the right word, and or that, let's say you go to reach for your coffee mug and you're just having a little bit of trouble picking it up and almost knock it over. It could be anything, but really anything that suddenly isn't working the way that it normally does is something that you should go and call 911 and get checked out immediately. Because there are lots of great acronyms out there for ways to memorize or to remember common symptoms of a stroke, but they're all incomplete. And so the one thing I like to tell all of my patients and everyone that I can get a hold of, and so thanks for giving me the opportunity to do it here, is if anything suddenly stops working, however mild it is, go in and get checked out. Because even if it's not a stroke, it's something. Something just happened, and it's important that we find out. Because there are some emergency treatments that we can do for some types of strokes. There are two main emergency types of treatments that we can do: clot busting medicines, which is actually what Danny was able to receive in the book, as well as clot retrieval procedures. And finding out whether or not one or both might be a safe option for you is not something that you can do at home. It's something that requires a lot of specialized knowledge, as well as some more pictures actually of the brain to find out whether or not either of these are options. So if anything suddenly stops working, please don't take a nap to see if it goes away. Don't wait around to see if it goes away. Just please come in, call 911, get to the nearest hospital right away, because we can really help people. And it's heartbreaking to see situations where I probably could have helped someone if they had come in right away.
I think that's another reason why I went fairly dramatic with Danny, because if it had been something mild, I think he's the kind of guy that would have waited around, taken the nap, or said, I'll feel better tomorrow, or. So, yeah, I think that's one reason I decided to go a little more on the dramatic side with Danny.
Yeah, or you're watching a hockey game to wait till the end of the game to come in. I have seen that with that and other sports quite a few times. Please come in right away.
When you're watching a hockey game and it's intense, are you at higher risk for having a stroke? Is it gonna make your blood pressure go up and you should worry about that? Or can we feel rest assured it's okay to go to our hockey games and cheer as loud as we want to?
I think everyone should live their life and go to those hockey games and cheer loud. Could something like that potentially be the straw that breaks the camel's back and be why a stroke happened at that moment instead of the next day or the day before? Maybe, but it's not going to happen out of the blue unless you were already about to have a stroke. So please, everyone, live your life. Go get excited and cheer on your favorite teams, and don't worry about causing a stroke in yourself.
But if you have high blood pressure, control it with medications and work with your
Yes, please.
healthcare team,
Please work with
please.
your healthcare team.
Okay. So even at the beginning of the novel, Danny's had his stroke. We hear the backstory coming in. But Tracy, as Danny's ready to come home, the team talks about needing to relearn literally every everyday task, and that he's going to need help with simple activities like preparing his meals and caring for his home. And of course, transportation to all of his appointments that he is now going to need to attend. So I think you were showing that stroke is suddenly life changing, like we've said, but that also it requires you to rely on other people, right?
Hmm. Yeah, 100%. That's the setup between these two, between father and son. And I especially loved the idea that there were certain exercises that, kind of Danny's homework, PT homework, or what that Kyle could help with, that would actually bring them in close proximity. Even that is a little challenging for them, but I think it's all part of healing their relationship for sure, too, as time goes on. But then also, Kyle learning, his ex wife sort of helps him figure this out, but what he can do to help Danny in the moment. Like, Danny's very kind of plumb and square guy. He likes things very tidy. And so she kind of gives Kyle that tip. And he's like, oh, yeah, this is something I can do to help my dad feel a little more in control. So, yeah, it's very much about letting people help you, which for some of us is a lot easier than others.
And it's a reversal of those roles that have been. So Danny was Kyle's father. He raised Kyle. He was always the caregiver. And so when the caregiver is suddenly, whether it's from stroke or some other medical or some other condition, the caregiver is certainly forced to receive care. That's really difficult for so many people who
Yes.
have been used to giving of themselves throughout their whole lives
Yes.
to then accept help, especially from someone that you used to care for. That's
Hmm.
really difficult. And I think one of the things that just rang so true for me in the book, a little moment that I really loved, is that as Danny recovers, at one point he makes Kyle breakfast.
Hmm.
And he's so proud and just feels important and he's able to kind of resume that caregiver role in this just tiny way for just a moment. And that rang so true to me and really struck me because when people have a stroke, it's not just important to recover the ability to be independent again. That's clearly a huge milestone for many, many people. But most people want to be able to resume all of the previous roles that they had, not just be able to take care of themselves. And so to be able to resume in some small way some of those caregiving roles and that leadership role in the family in just a tiny first baby step way really is feels like such a big deal to someone who has gone through this. And I just loved that little moment in the book.
Oh, that's great. I'm so glad you took that away. I hope a lot of people do because that's what I was going for. It's a small thing in that moment in time, but it's something he can do for his son who's struggling in that moment. And I love there are realizations that Kyle as the son here has along the way about why they've had this sort of tough relationship most of their lives, but when these roles are reversed to some degree for a little while, it's like Kyle gets a little different perspective on his dad and maybe why he was a tough guy, when Kyle was growing up. He kind of is able to think about all of that, and just that little shift in perspective helps their relationship a lot too. So much can come from that whole dynamic.
I also like how it highlights that Danny is still the person he was before he had his stroke. So if you're somebody who doesn't like to go unshaven, then not being able to shave your face is really a part of what's making you feel unwell and
Mhm.
could be impeding your ability to recover. So if people are caregivers for someone who's had a stroke, just kind of thinking through, is this somebody who liked something a certain way and can we bring that back, whether it's order in the household or seeing a specific friend or something that was very important to you before this event happened, because you're still the same person, just your brain has taken this injury, which hopefully most people recover from in the same way that Danny did. Courtney, there was another element to that with Danny as this shaving and not being able to tidy up his house scene was unfolding, that he was just incredibly angry, even
Yes.
throwing things at Kyle, accidentally at Casey. Do you see this mood, irritability, anger happen after stroke?
Certainly. And so mood problems, both irritability, anger, as well as depression, are very, very common after stroke. And it's both related to kind of the natural response to having something so out of control happen to you, combined with these chemical changes that are going on in the brain as your brain has had this area of tissue that has died and is trying to form new connections and recover. Another element that Danny experiences that makes someone a little bit more likely to be more easily frustrated is his difficulty communicating. And when people have difficulty communicating after a stroke, it makes it so much harder for them to, express those things that they need and those ways of regaining control that would be helpful to them. They can't get that point across. And so caregivers are put in a situation where you're trying to read someone's mind and they can't tell you what they want. They just are frustrated and they just can't get it out verbally. And so sometimes motions and throwing things is the only way that they can get across that they're frustrated and that real difficult emotional thing that they're going through. And so that is very realistic, and especially for people who have trouble communicating in the way that Danny does, it certainly is more difficult and more frustrating for the person who's going through it as well as for the caregiver.
I think when we feel so out of control and powerless, we do go to anger, to kind of cover up that fear and vulnerability. And I just in that moment, when he can't communicate, he hasn't shaven, his home is not the way it usually is. I just think that it was kind of it all hit him at once, and that's when he takes his anger out on the person who's around, who is Kyle in that moment. So.
Yeah,
Um,
we're all human, and you're just as human as you were before the stroke.
Yeah, absolutely. And he had a hard time communicating before the stroke anyway.
Mhm.
So yeah.
And Tracy, I think one of the things that resonates with me that Courtney just said is about Kyle in the caregiver role. This is often a role that people haven't trained for, that they are falling into immediately. And while it seems natural to know how to manage a household and make meals and get food, if you're somebody who hasn't done it or hasn't done it with the person you're caregiving for, that can be incredibly daunting. Never mind the fact that you had all of these other events going on in your lives, or in his case, living in a completely different part of the country. Can you talk a little bit about learning about depicting a caregiver?
Well, like you just said, so many times and I've seen this happen with friends and family members suddenly put into that role where all you want to do, best intentions, you want to do everything right, but you have no idea what you're doing. It's learning all of that. And I think that that's what happens with Kyle. And that's why that moment when he sort of spends the first few pages when he's on his way back home assuming that this is going to be kind of probably a quick stint, that, his dad is this tough guy. He's going to be fine. He's never called in sick, all those kinds of things. But of course, then he sees him in the hospital, as you described earlier. And I think that's, really starts to settle on Kyle that this is a whole other level of maybe what he was expecting. And this is a guy, that he always felt like there was a certain level of disappointment with anyway. So he's up against it, Kyle. But his dad needs him. He wants to be there, but it certainly takes a while for them to get in a groove. And there's trial and error and failure, but they work towards that, being able to work together in order to help his dad hopefully make progress.
I think an element of that is having compassion for the caregiver, and as a reader, really wanting Kyle to have more self-compassion for everything he's managing and thinks he should be doing so much better and gets so frustrated with himself. So, Courtney, about a month after Danny's home, he is shown to have made significant progress. His speech becomes smoother, his movements are more stable. He can even do some things in his own home without his walker. His cognition or memory returns to normal, or what we call his baseline. Is this a common timeline, or how long can that process of recovery take?
Great question. So, in general, the recovery after an ischemic or lack of blood type stroke, as opposed to a bleeding type of stroke, which is what Danny had. He had a clot type stroke. The recovery after that tends to be fastest early on, and then the rate of improvement slows over time. But that improvement continues and is overall a much slower process than any of us would like. And so there is often quite a bit of improvement over those first days and weeks, and throughout that first month, just like Danny experiences. And then that improvement continues, but over a slower and slower pace. By about 6 months or so after a stroke, most of the symptoms have improved. They're improved about most of the way that they're going to improve. And by a year out from this type of stroke, the symptoms really don't significantly improve. Someone's function can improve as they learn to find new ways to adapt to their leftover symptoms, but the actual objective, the way we measure it when we push and pull and test someone's strength type of leftover problems don't tend to improve much beyond that point. So it's a much slower process than patients would like, than would like. People are really impatient to get better, and I get it. This is a slow recovery. The brain is slow to recover, but it is really remarkable how much people do improve. Danny has some really significant leftover problems at the beginning, right after his stroke. And then he recovers really significantly, and that is very realistic. Some people have significant leftover problems after a stroke, but many people go on to have no leftover problems after a stroke.
Mm.
So there's hope.
There
Yeah,
definitely is.
and I hoped if he was committed to his, the recommendations, his team's recommendations, and his process and his therapies, and he's got support from not just Kyle but Casey and buddies in the community. It felt like all of that would only help him reach his goals. So that's where kind of the community piece came into in this book. Was yes, he definitely had to lean on Kyle, but there was a kind of a larger network of support for him too.
Tracy, your instincts were spot on with that. So having that not only immediate caregiver support, but really the team of people, both the team of medical professionals, including the physical, occupational, and speech therapists. And so we see Danny working and going to all of these appointments with his therapist to, slowly improve and improve. And we see how much that works. And we do know that getting as much therapy as early on as we can makes a really big difference for how strokes recover. And then emotionally and just, function wise, the broader community support makes a real difference in getting people back into what matters to them. And so it doesn't matter if your strength and, ability to do physical therapy tasks improve significantly, but you still stay largely homebound and have given up the activities that you previously enjoyed, that's still a really devastating loss of quality of life for someone, um, as opposed to if they're able to get out and really resume doing the activities, even if they need to do it in a modified way, resuming the
Sure.
things that are important to.
Yeah, I would imagine that connection to
Oh
each
yeah.
other and the people around them.
Mhm.
Absolutely.
Yeah. It's regaining your full sense of self is
Mm.
so important to people. And so we want to try to help people do that in any way that they can, even if it has to be modified. It makes a real difference.
I think that's a point I really wanted to make sure we closed with is that community is so important. Tracy, in all of your books, community and connectedness is so important. And so, if listeners do know somebody who's had a stroke or know a caregiver of somebody who's had a stroke, this element of showing up and being present, and in Danny's case, it was some of his buddies from the hockey community or buddies from the fire station, or he did a lot of volunteer work and having them come back into his life, whether they visited him at home or when he was then able to figure out how to get himself back into those activities, even with any of the limitations that he maintained. So I really like the message that there's hope after stroke, and also that it's really important to support both the person who had the stroke and the caregivers who have a really difficult job.
Hmm.
I completely agree.
So, listeners, this book has much, much, much more in it. Danny Stroke is really the beginning of the story, and we see his progress, which is wonderful, but there are themes involving the main characters. You're going to have to read the book to find out all about it. Thank you, Tracy and Courtney, for being here. It was a pleasure.
Thank you. It's such a treat to be able to focus on Danny. So often the focus is on another relationship in the book. So this was wonderful opportunity to talk about him and Kyle.
And thank you for having me in. And I want to thank Tracy for this really excellent depiction of what it's like to have a stroke, and how all the different ways it affects both the family and the broader community, and how life can really be still really valuable and meaningful, and it can bring people together in a way. It's a way that we want to have happen, but it certainly has big impacts on people's lives that certainly can be positive when you get to the end and look back in retrospect.
Read Talk Grow is a product of the Women's Health Center at Mayo Clinic. This episode was made possible by the generous support of Ken Stevens. Our producer is Lisa Speckhard-Pask, and our recording engineer is Rick Andreessen. Visit our show notes to see the books discussed today and for links to other health education materials. Follow us on social media like Instagram and Facebook, or reach out directly to our email, readtalkgrow@mayo.edu, with suggestions for books or topic ideas. We'd love to hear from you. This podcast is for informational purposes only and is not designed to replace a physician's medical assessment and judgment. Information presented should not be relied on as medical advice. Please contact a healthcare professional for medical assistance if needed for questions pertaining to your own health. Keep reading, everyone.